Hi, everyone. Welcome to the Introduction to Auditing for Compliance live webinar, the top of the hour. So I think we need to get started. Everything we talk about today, it's not meant to be legal or consulting advice. You really need to get a hold of a professional to consult with in regards to specifics about your organization's needs. Now, we will have a Q&A at the end. So take some notes, and then as time permits at the end, we'll have probably 5-10 minutes to go ahead and do questions and answers. We do have a lot of people attending today, so we may use the chat feature for communications. If you need help with something, use the chat feature. We have Shara as a co-host, and she's going to be helping people with any issues. And I better introduce myself. I'm Joanne Byron. I am going to talk to you today about my experience. I have years of experience in auditing and compliance, and I switched from being a nurse into coding and reimbursement, and then going into acquisitions and mergers and performing compliance audits, coding and documentation audits, and various types of other compliance audits for standard operating procedures for the purpose of acquisitions and mergers for hospitals to acquire doctors' practices, or for the due diligence when two practices were looking at merging with each other. I worked as a hospital paid consultant, and then I went on and worked for a CPA firm in acquisitions and mergers. I moved then into my own consulting business, where I performed a lot of coding and documentation audits, as well as HIPAA audits. And if you have any other questions about my background, feel free to use the chat, and I will try to answer those at the end of the program. Why your organization should be conducting internal audits is where we're going to start. How audits identify risk, and does size matter? Well, it might. Importance of an audit team, and do you need a lead auditor or not? Once we get through those issues, we're going to talk about the 4 specific phases of an audit. This program is really intended for people that don't have a lot of audit experience. So for those of you who are more experienced, this is going to be a basic 101 coverage of internal auditing and monitoring. And if you have expertise to share, you certainly can do this at the very end. Okay, let's talk about why we should conduct internal audits. There's lots of reasons. Compliance is the biggest one. Providers have expert medical training. They are scientists. They know how to diagnose, and they hire practice administrators and additional help to manage the aspects of the practice. And hospital administrators hire experts to manage various aspects of the organization. However, compliance really is the responsibility of everyone, and a top-down approach is critical for a successful program. C-suite executives, directors, providers, all of them must be committed to developing, implementing, and following the compliance plan through auditing and monitoring. Performing internal reviews of what is actually happening brings clarity to your organization's operations. And some of the answers audits can provide could be addressing these types of questions. Are there unidentified vulnerabilities and risks we need to address? Is our compliance program effective according to the 7 elements that's outlined by the Office of the Inspector General? Do we safeguard our patients' protected health information, electronic protected health information, PHI and EPHI? Is our handling of privacy and security compliant with HIPAA standards and requirements as a covered entity, or are we a covered entity and a business associate? Are we complying with everything? Are we recording and acting upon patient risk factors, monitoring sentinel events, administering safe and quality care? Are our patients satisfied with the care, the environment, and the financial operations of our organization? And are we financially viable, or do our documentation, coding, and billing practices, is there undue financial risk associated with that? I can tell you, you can have the most wonderful providers and doctors on the planet, wonderful bedside manner. The patients love your doctors, love your nurses. But if you're screwing up the billing, if there are insurance company nightmares, if there are billing mistakes, you're going to lose patients. Patients can walk, they can make choices. Their health plans give them a choice of where they can go for their health care. You got to get it right in all aspects of your operations. And that's one important reason when you conduct internal audits, you'll be able to determine where your weaknesses are and what you need to do specifically to take corrective action to strengthen those aspects of the organization. Compliance plan, it's a living thing. Not only does a compliance plan bring clarity, it provides evidence to validate the standards, which shows conformity. Standards written in a manner which are easy to understand, well, that helps us to train our workforce to address important aspects of day-to-day operations. Having a policy and procedure, standing operating manual gives guidance across all different levels within the business. Most people think of billing, fraud, waste, and abuse and illegal actions as the only threat or risk areas. Noncompliance in itself can lead into different areas of risk exposure. Why should all types and sized healthcare organizations conduct internal audits? It's all about risk management. Auditing is part of the overall risk management process for all organizations, and especially healthcare organizations, because we're so heavily regulated. So no matter how large or small you are, auditing and monitoring should be a part of your operating plan to identify problems for risk mitigation purposes. And just because you're small, maybe you're a small solo office, or you have just several providers with one or two locations, you can still be targeted for investigations for fraud and abuse. And sometimes it's very hard to have separation of duties and checks and balances when you have a small team. And we're going to talk about that later today in regards to how you handle some of those aspects when you are so small that you have limited resources. Let's review the purpose and objective of audits. Now, the purpose of performing an audit for your organization is to identify risk areas. And the objective is to identify strengths and weaknesses in healthcare business systems. And the auditor never creates the audit criteria. That would be a conflict of interest and it causes bias. Measures should be made against rules, regulations, and other established criteria that we don't create. It should be already there, created by legal counsel or other people other than the auditors creating policies and procedures for the organization. You should never audit a department that you used to manage, where you have relationships, where you created some of the policies and procedures. Again, that is a conflict of interest. You can't be objective when you perform the audit. And plus, you have the risk of damaging your reputation. You want to uphold a higher standard of being objective and being fair with your audits. You don't want to bring anything into question that you weren't being fair and objective. I have a polling question. Do you have a written, implemented corporate compliance program in place? And if you're not sure about saying yes or no, it's okay to say that you don't know. Not everybody has that information, especially if you're new in healthcare or new to auditing. So 92% say yes, you do have something written in place. 3% said no, and 5% you're just not sure. So that's fine. Let's talk about committed resources. Your executive staff, if you are larger, you're going to have a board of directors, C-suite executives. C-suite executives are your chief executive officer, your chief operating officer, your chief financial officer, all your chiefs. They have to be willing to commit personnel and resources to your audit program. You can't do this on a shoestring budget. You need to have some funding for it. You have to have people designated with the right expertise. And not only with the right expertise, but they have to operate independently and outside of any potential influence. And you have to be staffed with qualified experts. So some people might be auditing for HIPAA privacy and security. A coder might not be able to do that type of audit. If it's a clinical audit for quality care or OSHA, you might need to have somebody with a clinical or nursing background. If it's coding and documentation, you may need to have somebody that is not just a certified coder, but is also has enough clinical expertise to understand documentation and how it converts to appropriate coding and all of the things that creates a compliant claim for compliant reimbursement, which is very broad. It gets into medical necessity and other things. Yes, you need funds and resources. I think that is pretty clear, but you need to make sure that you have the ability to hire or contract with experts. We recommend employing a lead auditor who works with the organization's compliance officer if you are a mid or smaller organization. And that is important because when you are smaller, you can't have that objectivity. You can't achieve that very easily. And if you contract with somebody, it doesn't have to be full-time. It could just be maybe just once a year to supervise and to help direct or actually jump in and participate on performing some of the audits. It can be a great resource to you. How large is your audit team? So quite a few of you said you have compliance programs that are written and in place. And if you do have an audit team, how large is it? So let's go to the next polling question. If you have an audit team, what is the size of the team in full-time equivalents or FTEs? So you might only have one. You might have two or three. Larger organizations may have huge teams, and you also may not have access to that information or you don't know. So to share the results, 34 people have one, 22% have 2 to 3, 15% have 4 to 6, and 12% of you, which is good, has 7 or more, and 18% you're just not sure, and that's okay. Polling question number 3. For the size of your organization, do you feel your audit team is adequate? Or do you feel, so if it's adequate, you're going to answer yes. But if you feel that you're underfunded, understaffed, don't have the resources you need, answer no, or you're not sure. And that's okay too. And if you're new to auditing, you might not know what size team is adequate. So 30% said, yeah, you feel that your audit team is just about right. 44% no, you could use more resources. And 26% says you're not sure. And that is fine. So let's talk for a moment about the fact that if you are understaffed, it's a lot of resources and money in the budget to employ people that do nothing but audit. Larger organizations, It really pays for you to have a fairly decent employed audit team, but it doesn't hurt to contract outside with a firm that has expertise in the field of healthcare that you're in so that you can bring in that expertise only when it's needed. They're a contractor. You don't have to pay health insurance, employment taxes, and you only pay for the hours that they work. It can be very cost effective and add a lot of value to adding that additional expertise rather than hiring that expertise full time. So each team requires a lead auditor. And I want to talk to you a little bit about what that means. Even a team of one should have a lead auditor. Now, if you've taken our certified healthcare auditor course, you've heard this before. Somebody's got to lead the audit process, and there are a lot of steps within the 4 phases of an audit. If you don't have the leadership capability of conducting the audit, even if it's all by yourself, then you really shouldn't be doing the audits by yourself. You need to have somebody with the ability for planning and excellent communication and analysis skills. So if you're a team of one, that's fine. But you also need to fill the shoes of being a lead auditor. A lead auditor is in the position of initiating change. You are powerful because you influence individuals with the audit results, and that can happen across the entire organizational structure. I didn't think I was that important when I started doing auditing. I had flipped from nursing into coding into reimbursement, having to do audits to audit information and documentation because we were being investigated for some fraudulent claims. Found out that the insurance company auditors didn't understand the rules and regulations for reimbursement as well as I did. I had studied them. I had wonderful mentors, and I fought back. That's how I started my auditing. And because I got them to back down, they found no problems. There were no settlements. I educated them. That bought me a lot of respect within the organization, and I was given more and more responsibility, but not just responsibility. People listened to me. And when they would say, how do we need to improve? I had to choose my words carefully because they hung on every word. They really saw the value of what I was doing, and I ended up running an entire department. I was a department of 2 or 3 people, and we ended up being a very large department because of the results that we were able to produce. You are a change maker. You influence people, even if you're a team of one. Let's go over how every project needs a leader. And the person, you have to have both technical skills required to conduct the audit and the ability to initiate change, which we just talked about, to influence others to do the right thing, and to get everyone to share a common goal. They being the providers, would walk down the hall and they'd say, here she comes. She's going to tell me I'm doing something wrong with my documentation. And I need to really shift that view of not seeing me as the auditor, where I'm going to be coming and telling them what they're doing wrong and where they need to improve. It took some work, but I had to shift them to, here's where you need to strengthen your skills when it comes to understanding the documentation for reimbursement purposes. Coders can never tell doctors how to document for clinical purposes unless you are at least their level or above from a clinical standpoint. So we have to be very respectful of that. You document what you need to from a clinical and scientific perspective, but there are reimbursement aspects. We need to bring money in to keep the business going. So let me share with you, this is CDI, Clinical Documentation Improvement for Reimbursement Purposes. Once they started to get that, that started to shift their view of when they saw me walking down the hall with my notepad coming to see them. You need to lead with strength, wisdom, and kindness. The lead auditor should welcome questions, be learning about the stakeholders' challenges, cultivate a positive perspective. It's kind of summing up the things we've just talked about. And there is a difference between being a leader versus being a boss. So be careful not to condemn or criticize without having a full understanding of the stakeholders' actual or perceived limitations in regards to the process being reviewed. Nobody likes to have somebody looking over their shoulder telling them if they're doing it right, especially doctors and especially management people where you might be auditing their department. So we have to be very careful to always compliment things that we see that are going well and to ease into with facts where they need to improve. Facts will sum it up. Just lay out your findings in a very objective manner. People will be able to make their conclusion that they need to improve all on their own. So you don't need to shove it down their throat. You don't need to embarrass them or criticize them in any way. You want to also bring to their attention some simple solutions that might help them to strengthen and improve. And that gets into corrective action plans, which you'll probably end up being involved in, which brings us to the 4 phases of an audit: planning, execution, report what you found, and what are the corrective actions or recommendations based on your analysis or a root cause analysis. So we're going to go through and I'm going to give you some background on some things that I have experienced with all of these things. This is a summary of a lot of additional steps that are necessary. So when you're planning the audit, you need to know the who, what, why, where. So how is that going to be conducted? Who are you auditing? What exactly are you auditing? What's the criteria that you're going to be using? What are the deadlines? When does it need to start? What kind of team do you need to have? Is this something you can do on your own, or are you going to have to bring in a team and maybe some outside expertise? A lot goes into the planning. You just don't jump in and start an audit. It's important to understand that prior to performing any audit, you have to have support from the very top of the organization. Because whoever you are auditing, if the outcome isn't very good, they're going to go running to their superiors, to the board members, C-suite executives, the owner, and say, hey, this very unfair thing happened to me. I object. I'm not changing. They're going to throw their hissy fits. And if you have support from the top, that's going to help to mitigate that. Also, your approach, so that you don't incite that type of reaction, is going to also have an impact. Sometimes, no matter what you do, you're going to have people that are going to react very negatively to being reviewed and what they feel is criticized. That's where you really need to have support from leadership before you embark on that. Conducting the audit, it's got to be free of bias, not only for the lead auditor, but any and all team members, because that's the first place somebody's going to push back and attack, is that you have a vendetta against them. You don't know what you're doing. You don't have expertise to be able to evaluate their performance in any way, shape, or form. So you need to make sure you have your ducks in a row. You have the expertise you need, and you have the backing and support of administration. Bias is something that is very hard to work around. We're all biased in one way or another. because of experience that we've had in life and things that we have endured in our careers. But if we remain outside the process and work very hard, and the lead auditor should be working with the team very hard to be objective. And remember, keep your eye on the goal. What is the goal of the audit? We need to improve compliance. We want our job tomorrow. We want our reputation to be good as a healthcare provider. So we need to identify vulnerabilities to reduce risk so that we can keep our good reputation and mitigate financial risk of having to do settlements and fines and so forth. Your audit results will be biased if there's any conflict of interest. If you have friends in the department being audited, or you have a stake in the success of that department as an example. Put the time into planning. A large part of planning is based upon effective communications and strong leadership ability of the auditing team, even if it's a team of one. A well-executed audit is likely to produce recommendations which leads to corrective action that will drastically improve the process or the organization as a whole. Plan to monitor performance. Following up with monitoring after an initial audit is absolutely necessary, because how do you know if things got better if you're not following up to be sure? It's also an expectation of the OIG. Performing an audit without follow-up creates a situation where problems have been identified and there's proof that you identified them, but there's no proof that the follow-through to show correction is not there. So don't do audits if you're not going to follow up with monitoring and corrective action, and you keep monitoring until you see there's improvement. Okay, monitoring should be conducted on a scheduled basis. You need to make sure that you're reviewing utilization patterns, creating new comprehensive focused audits to be performed, evaluating computerized month-end and special reports, assessing reimbursement, denials, EOBs. A monitoring system is usually put in place because of findings from a baseline audit. And a baseline audit would be a first-time audit of some aspect of the organization. And it's our healthcare organizations are organisms. We're constantly evolving and changing. So we need to make sure that we're auditing frequently enough to be able to measure where we're going with all of our processes. Once the review is complete, the audit team can assist in guiding the development of a detailed, reasonable action plan. And you have to have measurable outcomes that can address the root cause. So you've got to dig down and ask, why did this happen? Well, why did that happen? Well, what caused that to happen? You just keep asking why? And remember, each successfully executed audit builds better relationships and promotes a culture of compliance within your organization if you're doing it right. If you have the right attitude, if you have the right spirit, if you are a leader, not a boss. Okay, let's talk now about reporting your findings. It should be clearly written. Don't use a lot of jargon. It needs to be in a formal report format. You need to use words that show objectivity. Your opinion doesn't matter. Nobody cares about what you think. People only care about what an auditor can prove. What is the evidence? What is the information? What are your findings? And let the people, the executives, the board of directors, the provider make their own conclusions. So here are the criteria that was measured against. And here's how the audit findings ferreted out. It is going to be quite obvious whether the criteria was met or if there's non-compliance. You may be asked to help write the corrective action plan, and in smaller organizations, you're likely to be the one to draft and execute that plan. So, what must be the focus of all your efforts? As the audit concludes with implementing corrective action, followed by monitoring the results, remember compliance to rules, regulations, patient safety, privacy should all be the focus of your efforts. So, in short, compliance must be the focus of all your efforts. Compliance standards must be written, not just written and in a binder, but there must be training, procedures implemented and followed, and monitoring performed to ensure the standards are being understood by your workforce members and integrated into everyday tasks. It's very important that the lead auditor, even if you're an auditor of a team of one, to work closely with the organization's compliance officer, legal counsel, and other compliance advisors in your organization. Now, for smaller organizations, that might be the physician who's the owner, the practice manager. It might be someone, a consultant that's hired to help manage compliance for your practice. But you need to work closely together. Most professionals have already completed a corporate compliance training program that are managing the compliance program for a healthcare organization. So therefore, we have to assume that they have expertise in fraud and abuse. And if you don't have this type of experience or training, be sure to work closely with the compliance department and legal counsel for direction and assistance. But the more broad your audit responsibilities, the more training you should have in all aspects of fraud, abuse, HIPAA, OSHA, any area that you might be tasked with auditing for your organization. Okay, I am going to open this up now to question and answer time. So we have some new messages. Let's see. We have some comments. Okay. It is unbelievable to me how large my organization is at 5,000 employees in healthcare with only one auditor. There's a scope limitations in my compliance officer or compliance office manager when I have findings. Let's go ahead and talk about that for a minute. Large organizations with 5,000 employees. I've worked with organizations as clients, or I've been an employee of large organizations. One auditor isn't enough to do a fair job, to be able to span the scope of compliance and to be able to identify all the areas of potential non-conformance that could lead to settlements or damage to your reputation. My recommendation would be to recommend a consulting firm come in and work with you on an as-needed basis, off and on throughout the year, to conduct certain types of audits. I think doing a cost-benefit analysis of how that would work would be one approach, showing if we don't catch problems, this is how much it could potentially cost us versus putting the resources in to make sure that we're doing it right, or that we're catching the problems early to mitigate further risk down the road. Anyone here is a compliance department of one? Daniel wants to know that. So if you are a compliance department of one, somebody says, yes, they are. A department of one is not unusual for mid and smaller organizations. The OIG recommends middle-sized and smaller healthcare organizations often just have one compliance officer, but larger organizations, and your argument can be, the Office of Inspector General expects larger healthcare institutions such as hospitals to have an entire compliance department. And that compliance department should answer to the board of directors. So there's some specific guidelines for that and the general compliance guidance. And you can use that compliance guidance to show your boss and say, we really should have a compliance team. A team of one isn't enough. An auditing team of one person isn't likely to have the expertise to be able to audit all the different things that our organization does and do it well and do it objectively. Okay, another question. How do you handle management trying to hide findings? I've run into that before. And that is why you, as an auditor, you work closely with the compliance officer, but you need to make sure that who can hire you and fire you isn't anyone that could hide those findings. So you would go to your boss, hopefully somebody on the board of directors, and say, these are the findings. So you don't hand the management your findings necessarily. They go to the very, very tippy top at the beginning. And that way, management can't hide it. Now, if you're talking about hiding problems from you as an auditor so that you don't discover them and you can't get the data to show the evidence of the issues at hand, that can be a problem. And it's not an uncommon problem. There's turf wars. You're not going to come in and look at my department. You're not going to come and see what we're doing, whether it's right or wrong. The heck with you. Who do you think you are? And that's where you have to be empowered to be able to be an auditor. An auditor is a very powerful position if you are given the authority and the responsibility that is due to that level of a position. I don't know if that helped you or not. Okay, let's see. What complete skills are needed to be an auditor? I work with a group of urgent care. I do their lab facility and OSHA audit. The only thing I don't do is chart or documentation audits. I'm a certified biller and I want to know what more skills I need. Please advise. That's a really good question. An auditor can be an auditor. It might be somebody that doesn't do anything else except for audit for quality care from a clinical perspective. It could be, and that might include facility, lab, and OSHA. If you want to get into, and you have your billing certification, so that's really good. The next thing would be to maybe get more training in overall compliance, get certified as a compliance officer, not to become a compliance officer, but to know the rules and regulations so well across the gamut that you could kick in your certified billing and coding and documentation skills so that you can start doing chart audits and billing audits. I would start with billing audits because you're a certified biller. See if you can become a certified coder or get certification in clinical documentation improvement. You're going to need to improve your medical terminology skills and really start to learn and understand in depth what the doctors in your organization do and the terminology that they use and how that translates to reimbursement. How do you handle management that downplays and minimizes the risks that the audit findings have discovered and disclosed? That's a really good question. And it happens a lot. You're dismissed. You're not taken seriously. The best thing to do is the reports go to the highest channels in the organization. And management might try to downplay it, but you're reporting your facts and your observations in an objective manner. And that's all you can do. Auditors, you don't own the problem. And even if you're a consultant and you are invested with your client, all you can do is plan the audit, execute the audit, get your objective findings, write a beautifully written report of findings using charts and graphs, the criteria in an objective manner. And the rest is up to the organization to take that information. If you are employed and management is downplaying and minimizing the risks, you've done your job to bring it to their attention. And if there is an investigation and something implodes, they can't come back on you because you did your job. You notified them. It isn't your job to go in and fix it. This is where your leadership skills of influencing people and sometimes creating, it can be an ad hoc committee, but get a team together of the biggest naysayers, the people that object to what you're doing the most. It's a challenge dealing with those people at first, but when you get them involved and now they are becoming part of this process that they have opposed, and they start to see the value of what you're doing, how you're doing it, they can be your biggest cheerleaders in getting other people that are resistant in your organization to come around. If anybody else has any other suggestions that are better. Skills needed to be a compliance officer. You need to have some training. We've actually had quite a few attorneys come and they join a firm and the firm will say, we want you to get healthcare corporate compliance training. So they go through our program. But going through something regimented that goes through what the OIG, what prosecutors look for during an investigation, the Department of Justice, all of the applicable rules and regulations. Our program talks about OSHA, the ADA, EMTALA. It isn't all coding and billing, fraud and abuse. It's much broader than that. So the biggest thing is when it comes to being a compliance officer is to have a lot of healthcare experience. It doesn't matter whether it is administrative as a coder or as a biller, revenue cycle manager, or as a nurse or a doctor, but you need to have extensive healthcare experience. You need to understand healthcare and how heavily regulated it is in general. That will give you the appreciation of the responsibility. And then go through some formal training and lead with your strengths. So if you've been a physical therapist and you understand how therapy charting and compliance and things, then start with that and become the lead in compliance in that department or that area and grow from there. A lot of people are promoted into being a compliance officer and they have catch up to do. They are excellent in certain areas and very weak in other areas. And that's where training, like with HCCA, they offer compliance training. We offer compliance training. There's other organizations that do. You look around to see the different programs and what's going to meet your needs and then go through the training. Whether you get certified or not, that's up to you, but go through the training because that knowledge is invaluable. I had the same audit issue. So I did my own audit report and showed potential risk loss based on recent press releases from the OIG. Daniel, that's a really good response as far as showing press releases. Lessons learned. Other organizations might not think something is important, and then an FQHC somewhere else in the country, similar in size, gets nailed really bad. All of a sudden, your FQHC is on alert. Showing them, here's some things that are going on. Here's what you need to be aware of. We better make sure we're not making the same mistakes. Same thing's going to happen to us. Meaningful audit report examples. Is there a toolkit or resource available to use as a guide that you would recommend without purchasing software? That's a really good question about report examples. It really depends on the type of audit. If you're doing something more clinical, but the format is always the same. You're going to do an executive summary. You're going to have your findings, and then always have lots of detail that you can put into a more detailed report. But an executive summary is usually the one that goes to the board of directors. I don't think that you need to purchase software unless you're a very large organization with very complex moving parts when it comes to a very broad audit. We have some resources with our certified healthcare auditor course, and other companies that offer healthcare auditing courses, I'm sure, have their toolkits too. What courses will you recommend? I do career counseling, so you can always go onto contact us on our website and request counseling. It depends on the type of training that you need with the experience that you have. And that's what's going to drive it. And it may not be a course that we offer. It might be a course that another company offers. Or I might tell you, here's what to look for when you're looking for specific training that I think you need in your career to achieve your objectives. What if you get the training, have the experience, and they will not sign off as a power control over you as a professional? Then you look for another job. You have the training, you have the experience, and let's say you even get certified. If you don't have the authority to go with the responsibility, and you don't have the backing and the support of high-level people in the organization, they're just setting you up to fail. You're just going to be going through the motions. Nobody's going to really listen to you. Nobody's taking the audit program seriously. And the best thing to do is go onto our Career Center page and take a look to see what jobs are out there and what they're paying and what your options are. Maybe you need to help the organization rewrite your job description. Go carefully. You don't want to lose your job before you have another job, but you need to be taken seriously as an auditor. It's a very responsible position in the organization. And Daniel says, exactly as the saying goes, compliance is expensive to maintain, but it's more expensive to be in non-compliance. And that is true. The damage to your reputation could be irreparable if you are found that there's fraud and abuse going on. And the fines and the civil monetary penalties, the government's not going to shut you down with penalties so hefty that you can't afford them, but the bad press that goes with it. And if you have thin profit margins, it could throw you in the red. It would have been so much cheaper just to do it right from the beginning. Okay, the OIG has excellent examples of reports. That's true. I don't know if they have excellent examples of audit reports, but if somebody wants to put that in the chat, that would be great, of the exact kind of audit reports. They produce their own reports, but which are very extensive and things like that. It may or may not be what you're looking for. Kristen asks, if management is downplaying potential risks around audit finding, that's a huge problem. I'd look into a new manager. Could they be unaware of compliance in general? But yeah, I find that to be a huge, extremely problematic area. If it were me and I couldn't get anyone to support me in the concerns, look for another job. I tend to agree with Kristen. Auditing allows you to delve into the detailed workings of the organization, and you come out with knowing where the problems are, what needs to be resolved. And it weighs heavy on you when nobody pays attention to the audit results and nobody wants to fix the issues. And then let's say you move on and the organization comes under investigation. The DOJ is going to find you. They're going to find where you're working now, and they're going to drag you back and say, why didn't you whistleblow? Why didn't you do something to bring this to light? And you're going to say, well, I left. So just make sure you document everything you possibly can. We don't encourage people to be whistleblowers. But when you execute a good compliance program with auditing and monitoring, and you follow up on complaints, areas of weakness, nonconformances, and take your best efforts, it's never going to be perfect. But when your workforce sees that the organization is making a best effort to improve, you're just not as likely to have whistleblowing, and you're going to have a more satisfied organization. And what you're doing through auditing and monitoring is you're building a culture of compliance where everybody is expected to be honest, straightforward, and to make your best efforts. But you need to be given the resources to do that.